Bill, thank you so much for joining us.
Thank you, Marie. Thank you for having me.
So walk us through right now your focus as far as serving those who have needs and your patients in the mental health facilities that you guys have.
Well, our focus is continuing to provide services for the almost 4,000 children and adults that we see, and we're staying quite busy doing that, actually.
We know this is a stressful time for a lot of people. Are you getting an influx? Are you seeing an influx in new patients?
The stress and anxiety that we are seeing out there is not necessarily translated into an influx of new clients. Again, we've got 4,000 people that we're reaching out to, and that's just here in North Central Alabama. So it takes quite a bit of our effort just to reach out to them and check on them.
What kind of policies and procedures have you guys changed there as far as working with your 4,000 or your over 4,000 patients to make sure that you are meeting their needs as we go through these times?
It's been kind of almost a gymnastics act because of COVID-19. We've not really had our facilities open to the community. We've been reaching out through telemedicine and calling folks on the phone the best way that we can. We still have new clients that have to see the doctor for the first time, but we take very strict procedures and protocols for them to even enter the facilities. So a lot of effort has been going out through telephones, telemedicine, and in-home teams reaching out to our clients.
I know nothing can take the place of that face-to-face meeting. What are some of the challenges that you're seeing, though, when it comes to some of the telehealth appointments?
Well, like with anything, most communication is nonverbal. So when you're doing it on the phone or even through a camera, it's difficult to really ascertain sometimes where people are coming from and what they're experiencing. But given the times that we're in, I think it's the best that we can do.
Talking about making sure that your patients are getting the care that they need, what are some of the tips or maybe some of the advice that you have for your patients who are noticing that their anxiety levels may be spiking a little more than usual? Maybe they thought that they were getting it under control and then now it's ramped back up. What's the advice from your end?
There's a lot of good information out there from the CDC and other sources, things that we know. Go outside, get some sunshine. Be mindful of the food that you eat. Try to get enough rest. Stop watching the news 10 hours a day. These are some basic things that we all need to do to help reduce anxiety and depression that really, quite frankly, everyone's dealing with. So some of these basic things just for general health are tremendous to help our clients.
And you mentioned that you go back to the basics, and it's not one section over the other. It all has to kind of work together to complete your system and to complete your mental health.
Absolutely. You cannot separate good mental health from just good living.
I want to bring up about those who are serving. I want to talk about your clinicians right now. They're seeing a lot, and I know that they're probably frustrated too without being able to get that person-to-person contact. How do you help protect them and make sure that they're taken care of during these times?
Well, the management of the mental health center has done a phenomenal job of staying in constant contact with our program directors and our direct staff. Many of our staff are actually working from home over the telephone, so it's not just a challenge for interacting with the client, but with interacting with staff also. They've put in some tremendous hours, long days, nights, weekends, keeping up with staff. We have telemedicine, some cloud-based software where we're able to keep track of the services we provide. So it's a lot of talking without actually having a lot of face-to-face, which is stressful for everybody. This is a learning curve for the whole world.
Absolutely. And before we let you go, I got a scenario for you. Say there's somebody out there at home watching now, has not been a patient, has not received any treatment before, but they know that something's off and they need help. What are those next steps that somebody at home needs to do?
Like we would always encourage them, they can speak to their primary health care provider. They can call their local mental health provider. There are community mental health centers all over across every area of the state of Alabama. If they're not sure where to call, they can call 211 and they can get information about services anywhere in the state.
All right, Bill Giguere, thank you so much for your time. We do appreciate you.
Thank you, Marie.